Hi, Dr. Scott Jensen here. I just want to give a quick little update on what's going on in the world of autoimmune diseases as well as a new variant. Yes, you may have heard that in South Africa, another variant, a B11529 variant, has been discovered. The Botswana government has indicated that the 4 cases they've identified were all in people who had been fully vaccinated and were getting pre-tested before flying. So there's a concern about that. But I need to share with you that this is what viruses do, especially RNA respiratory viruses. They do mutate. If you compare what's happening now to the original virus that was identified in late 2019 in Wuhan, China, it might look like this. And this would be the nucleocapsid here, and then this would be the spike protein, these paper clips. And that might be what it would look like, okay? But what's happening now is we're getting mutations. The new variant that has been identified in South Africa just recently and has been identified in European countries as well, causing some travel stoppages. This new variant has 50 mutations on the spike protein. So perhaps the new variant would look like that. So now we have not just these original spike protein morphologies, but now we have a new one, and that would be what I identified, the B11529. We don't have any reason to think that there's greater lethality or killing capability for this virus. This is what viruses do. And I think that we just have to let the science breathe, and we'll keep learning about it. But that's what happens. This is the nucleocapsid, which is a protein that connects with the viral RNA and sort of encloses it. And then we have the spike proteins protruding. The other thing I want to comment on is autoimmune diseases. I've had several patients ask about that, and they say, what are autoimmune diseases? Basically, that's where an antibody formed by our immune system attacks our own tissues. Common autoimmune diseases include rheumatoid arthritis, a variety of connective tissue and inflammatory disorders, myasthenia gravis, Hashimoto's thyroiditis. The fact of the matter is we're seeing so many autoimmune diseases that I don't think we can really count them anymore. I think that we just have to acknowledge that they're on the increase. It may be due to our environment. It may be due to the things we inject ourselves with. It may be due to some of the medicines we take. But the fact of the matter is autoimmune means our immune system attacks ourselves. And we're just going to have to let some of that science breathe as well, because we're learning more about it every month. I hope that helps. In terms of the South African variant that's just popping up, I have no particular reason to say that this should be a reason for us to get jazzed up in terms of our fear level. Let's just go on and do the best we can. Thanks.